Yeah, so first we'll start with a small context and background session. So as you all know, there is the natural greenhouse gas effect which happens on Earth, which is the process that helps to maintain the temperatures that is favorable for life to happen on Earth. And in the natural greenhouse effect, what happens is that the solar radiation from the sun enters into the Earth's atmosphere and is absorbed by the Earth's surface and is radiated back into the atmosphere. Some of this heat is trapped by greenhouse gases that are present in the atmosphere, and the rest is escaping into space. And this is the natural greenhouse gas effect. But what has been happening in the last century or so is that there's a lot more greenhouse gases present in the atmosphere due to human activities. If you see the table here on the side, it shows the different greenhouse gases such as carbon dioxide, methane, nitrous oxide, and others, and also this human sources of these greenhouse gases such as fossil fuel combustion, landfills, agriculture, industrial activities, etc. So because of all of these human activities, there's a lot more greenhouse gases present in the atmosphere. And now what is happening is that when solar radiation enters into the Earth's atmosphere, a lot more of the radiated heat is trapped in the atmosphere than is escaping into space. And because of this, global average temperatures have been steadily increasing since 1850, and it is now 1.2 degrees Celsius more than it was in pre-industrial levels. And this is called as global warming. And what it is also causing is climate change, which has been termed as one of the biggest health threats for human life in 21st century. So what is a carbon footprint? A carbon footprint is basically the sum of greenhouse gas emissions that are resulting from an activity or a facility or the use and manufacture of a product. The carbon footprint can be an indicator of sustainability, and it allows us to identify the contribution of each activity or a product to climate change. And the carbon footprint can be measured using various tools such as the one that we are going to see today. An important element of carbon footprint is there are different types of gas emissions divided into scopes, and this is based on the greenhouse gas protocol. So the greenhouse gas protocol divides the carbon footprint into three. Scope 1, which is direct emissions. So if you take an example of a hospital, all the emissions that come directly from products and services owned and operated by the hospital itself is scope 1 emissions, and these are known as direct emissions from the hospital itself. Scope 2 is indirect emissions, and this comes primarily from electricity purchased for use in the hospital. And scope 3 is another form of indirect emissions, which comes mainly from the supply chain and supporting services of the hospital. So all the goods and services that are purchased by the hospital, for example, all medical equipment, pharmaceuticals, etc., all of the purchasing for the hospital, as well as supporting services such as employee and business travel, etc., all of the emissions that come from these processes come under scope 3 emissions, and these are also indirect emissions. And if you look at the pie chart here, it shows us that in the health sector, scope 1 emissions, which is direct emissions from a healthcare facility, comes up to only 17% of health facilities emissions. Scope 2 emissions is about 12%, and the biggest share of greenhouse gas emissions from a healthcare facility is from scope 3, which is the supply chain and supporting services from the hospital. So coming to the Climate Impact Checkup tool, this is a tool that's been developed by the Healthcare Without Harm organization. And it's a tool specifically developed for measuring the carbon footprint of healthcare facilities. There are lots of other tools out there which can measure carbon footprints as well, but this one is specifically caters to the healthcare sector and hospitals. This tool uses annual data of energy consumption from hospitals, transportation, waste management, as well as gases specific to the healthcare sector, such as anesthetic gases, inhalers, and other cooling gases. And what this tool provides is an estimate of the carbon footprint of the facility. It also helps to identify the major sources of emissions and also provides information that can be used to develop a customized mitigation plan for the hospital, which is on how to reduce greenhouse gases from the facility. So as I mentioned before, carbon footprint is divided into three scopes, scope 1, 2, and 3. And these are the different emission sources that this tool can give the footprint for. Under scope 1, which is direct emissions from the facility, this tool can provide the carbon footprint from stationary combustion, which is fuel used in stationary combustion, such as on-site backup diesel generators. This tool can also provide a footprint from mobile combustion, which is fuel used for mobile sources such as transport vehicles. This tool also gives emissions from fugitive emissions, such as cooling and anesthetic gases, and also waste on-site treatment. Under scope 2, it can give emissions from purchased electricity. And under scope 3, which is supply chain and supporting services, it can give emissions from business travel, electricity transmission and distribution losses, inhalers, waste off-site treatment, and employee and patient commuting. So the final value of the carbon footprint is given in a unit known as tons of carbon dioxide equivalent. Carbon dioxide equivalent is a unit that's been developed which can give the value of all the greenhouse gases in one unit. And how this is done is using a conversion units known as global warming potential. And how this conversion works is that carbon dioxide is taken as the reference point, having the global warming potential of 1. And in this reference framework, methane has a global warming potential of 25. What this means is that if 1 kilogram of methane is released into the atmosphere, it traps 25 times more heat than 1 kilogram of carbon dioxide. Similarly, if 1 kilogram of nitrous oxide is released into the atmosphere, it traps almost 300 times more heat in the atmosphere than carbon dioxide does. So using this reference framework, we can calculate all of the greenhouse gases emitted by a facility and provide the carbon footprint in one unit known as carbon dioxide equivalent. So how do we access the Climate Impact Checkup tool? The Climate Impact Checkup tool is available on an online platform known as GGHH Connect. And currently this is available only for members of the Global Green and Healthy Hospital Network or the HELP network in India. So to access this tool, you must be a member of this network, which is completely free. So if anybody wants to access this tool, please write to us and we will provide the email in the chat box. We will give you a free membership to the HELP network and you can access this tool from there. So now I'll go to the tool itself and give you a technical training for that. Before that, if anyone has any questions for anything I've told until now, please ask now.
So Indu, you're going to put the email for membership, right? For membership to help through which people can access this tool.
I'll put that in towards the end of the webinar.
Okay, because there is a question already, somebody's asking how can we access the tool? So it's basically membership in the network of Global Green and Healthy Hospitals, of which we have an India arm as well. So yeah, please share that email ID, or Ms. Roor can do that maybe.
Yeah. I'll just open up the tool itself now, just a minute. Yeah. So this is the GGHH Connect platform, and you have to get a login ID, which we can help you with. Yeah, so this is the Global Green and Healthy Hospitals Connect online platform. This is a platform which has tools for helping hospitals reduce their environmental footprint, which is housed under the Hippocrates Data Center. I'll take you through all the other resources available on GGHH Connect as well. GGHH Connect has a discussion forum which member hospitals can use to talk to each other and ask each other questions on sustainability initiatives. It also has a resources section where there are guidance documents which hospitals can use to see what are sustainability initiatives in water management, waste management, energy efficiency, sustainable buildings, and also the latest guidance document, which is the chemicals guidance document. There are also case studies from hospitals around the world showing best practice in sustainability initiatives. And there are also webinars, recordings of past webinars. So to access the Climate Impact Checkup tool, you have to go into the Hippocrates Data Center. And go to Data Forms. And here under that, we have the Climate Impact Checkup tool. So I'll just start the tool right now. So yeah, so this is the Climate Impact Checkup tool on the GJH Connect platform. So as you can see here, it's divided based on the scopes, which I just mentioned before: scope 1, scope 2, scope 3, waste, and also there is a comment section. So first, what they have here is treatment of sources and notation keys. So as I mentioned before, there's a lot of information that this tool asks for to measure the emissions. So it asks for electricity consumption, it asks for anesthetic gas usage, it asks for waste data. So hospitals might not have all of the data that this tool is asking for. So in such a case, what to do is, if you have the data that the tool is asking for, you have to click estimated option and put in the data that you have. If you have, if for example, the hospital is producing a lot of waste from which emissions are coming, but you do not have data on how much waste you are producing, you have to click data not available and skip it for now. And then the hospital can start collecting data later and filling it in when they get it. There's a third option for emissions occur in the hospital, but were not estimated because data management is very complex. So in a lot of data that's been asked for, it's not easy to collect the data. So if it's too complex for the hospital to measure it, you can click not estimated complex. And the final option present here is not occurring. So if an activity or a process is not occurring in the hospital, for example, some hospitals might do composting on site from which we can calculate the emissions, but some hospitals might not be doing it. So hospitals that do not have it can click not occurring when the question is asked. So moving on, we have the year. So we have to first select the year for which the carbon footprint is being measured. And this can be any year, it doesn't have to be the present year. It has to be the year for which you have all of the data available. So right now I'm selecting 2021, and to reiterate, all of the data that's been requested in the tool has to be annual data. So here they also have a question: what are you doing with the checkup tool today? So today we are doing just a learning and training session. So you can click learning how to use the tool. If you want to if you have all the data and you want to submit that data, you have to click the first option, which is calculating and reporting emissions. But today we're just learning how to use the tool. So we're going to click this option. Moving on to the next page, we have come to scope 1. And as I mentioned before, scope 1 emissions are those that occur from sources owned or controlled by the healthcare facility itself. These are direct emissions that come from the hospital, owned from the hospital itself. And the first section here is stationary combustion. Stationary combustion is emissions resulting from burning of fuels in stationary processes. So the easiest example here is diesel backup generators that are there in a lot of hospitals that provide backup electricity. And the first thing that you have to do for any of the data inputs here is to select if you have the data or if you don't have the data. If you don't have the data, it removes the table for you. Or if it's not occurring, if you have the data, you have to put estimated and fill in the values here. So here on the left, you can see all of the different types of fuels that are used in stationary combustion. And you have to select all of the fuel that is used in your hospital for stationary combustion. So for the example that I gave, which is a diesel generator, you have to put in here the amount of diesel, select the unit as liter, put in the amount of diesel that is used annually in the hospital. I'm just going to put random values. I'll put 1,000 here. And then this tool gives you the emissions from using 1,000 liters of diesel in a year. And it gives you the emissions in carbon dioxide, methane, nitrous oxide, and also cumulatively as carbon dioxide equivalent. So similarly, if there are other fuels used in stationary combustion, if there are kerosene lamps or any other fuel used, you have to put in how much you're using for each fuel, and this tool will give you what are the emissions from that. Next, we're moving on to mobile combustion. This will give you the emissions resulting from fuel burnt for transport carried from vehicles. So for example, if there are ambulances that are operated by the hospital, all of the emissions that come from the fuel used in that would come under this category. So in this table, we have natural gas, gasoline, which is just another name for petrol, diesel, biodiesel, etc. So here we have to put in how much of fuel you're using for each vehicle that is there operated by the hospital. So for example, if the ambulances are running on petrol, we select liter. And again, I'm putting random values. How much is the annual consumption of petrol by the hospital? And then it gives you the emissions from that. Next, we're moving to cooling and fire suppression. So this includes all the gases that are used in cooling sources, for example, refrigerators and freezers that are used in the hospital, as well as fire suppression, such as fire extinguishers. So under this category, you have to select first the type of equipment. And here you have a drop-down list of the different types of cooling and fire suppression equipment. For example, I'll take an example of a refrigerator. And under this, there is a big list of all the gases that are used for cooling and fire suppression. What you have to do is go to the refrigerator, see what gas that the refrigerator uses, which can be found from the refrigerator itself, or you can go to the manufacturer or find the information online. Right now, I'll just select any random gas. And here you can see that it's giving the global warming potential of the gas as well. So HFC 152A gas has a global warming potential of 124. And here you have to select again the unit and put how much of this gas is reloaded into the refrigerator annually. Again, I'm putting a random value. And then it gives you the emissions from this. I'll just do another example here. So for example, freezers that are used for vaccine storage. Here again, I'll select a different gas. And you can see here, this gas has a much bigger global warming potential than the previous gas. So this gas is 9,000, whereas the other one is just 124. Again, select the unit and put in the value annual usage. And it gives you the emissions from it. And here you can keep selecting how many ever refrigerators or cooling equipment you have, and you can keep adding more rows as well based on how much equipment the hospital has. Next, we're moving on to medicinal and anesthetic gases. Here, they're asking for the different anesthetic agents. So there are 3 main anesthetic agents that are used in hospitals. They have isoflurane, sevoflurane, and desflurane, as well as other medicinal gases such as N2O and CO2 that are used for different purposes. So here in anesthetic agents, they're asking for the bottle size. So you can put in 50 ml bottle and the number of bottles used annually. So I'm putting in random values. And here it gives you the emissions. So there are different bottle sizes. If there's a 25 ml bottle size and the number used annually, then you have to put in all of these values and you get the emissions here. Similarly, you put in for sevoflurane, desflurane, and all the other gases as well. Moving on to the next page. Now we come to scope 2 emissions. So as I mentioned before, scope 2 emissions are those that result from generation of electricity purchased by the institution. So this section is pretty straightforward. You only need the amount of grid electricity that the hospital purchases from the grid. It's not any solar power or wind power that the hospital self-generates. That is not included here. This is only the grid electricity that the hospital purchases. So you have to put in the number of units of electricity consumed annually. So I'll put in a random value here, and then it gives you the emissions here. So they also have a second category in scope 2. A lot of hospitals purchase steam, hot or chilled water, but this section is only for US and Canada. It is not for hospitals in India. The tool doesn't have a facility for Indian hospitals here. So here you have to just click not occurring. Now we move on to the next page. Now we've come to scope 3 emissions. Scope 3 emissions, as I mentioned, result from activities of the institution, but do not occur from controlled or owned sources. So this is mainly from the supply chain of the hospital or supporting services. So the first section here is business trips. So if staff of the hospital are going to attend conferences or workshops or seminars outside of the hospital, they are traveling with different modes of transport that use fuel. So all of that would come under this section. So if there are no staff attending conferences or anything, you can just put not occurring. But if it is happening and if it is estimated, you have to click this and put in the data here. So the first thing you have to select is the mode of transport. So for example, if it is travel by plane, select plane and put in from and from where to where, and here the distance and how many times this trip was made during the year. So you can put in 2. And then for another example, you can select so a car traveled 15 kilometers, trip made 3 times. So just like this, you can put in all the business trips that have been done for the hospital, and you can keep adding more rows as needed. The next section in scope 3 is employee commuting. So here we would estimate the emissions that come from the travel that employees, hospital staff do to and for the hospital. So here again, you would need information on the different modes of transport that the staff are using to come to the hospital and the distance that the staff are traveling. So this would have to be, you have to ask the staff in the hospital for this information. And here again, you select the mode of transport. So for example, a petrol car and the distance 15 kilometers, you have to put in only the distance one way, and then the tool will multiply it by 2 for a round trip. And the number of days a week. So you can put in 5 or 7 days a week, whatever it is. And then you can put in information for all of the staff, and you can do averages as well. So for example, if 10 staff are traveling by metro and they are traveling a distance of 20 kilometers, then you can just put in that number of days a week, 5, and then it gives you the values. Next, we're going to patient commuting. Here, this is a section that will estimate emissions resulting from patient travel to and from the hospital. So this is information that is even more trickier to get, because you would need information on how patients are traveling to the hospital and the mode and the distance of travel. So this you will not easily have like other information. So you would have to do sort of a survey and a sampling method to get this data. And the sample can be done either for 7 days or a month or annually. So you'd have to, for example, for 1 week, ask all the patients who come to the hospital what mode of transport that they're using and what distance they're traveling, and then put this here as an average. Again, select the mode of transport. Maybe they're taking a taxi and coming, and they traveled for 15 kilometers, and you can put in the reason as well. You can ask them the reasons for their travel. So medical consultation, for example. And then you can put in all the information that you collected in your survey into this, and you can add more rows as needed. The next section is inhalers. So here, this section estimates emissions that result from 2 types of inhalers. One is meter dose inhaler, and the other one is a dry powder inhaler. So what information this section asks for is also inhalers in 3 different, dispensed at 3 different locations. So one is dispensed at the institution. So if there are patients who are in the hospital and they've been given inhalers to use in the hospital, that should be entered in the first section. The second section is sold in the central pharmacy. So if inhalers are being sold in the hospital pharmacy, those inhalers should be entered in the second section. And the third one is those prescribed by doctors. So that should be entered in the third section. And here what they're asking for is the number of inhalers in the first section dispensed at the institution annually. So I'll just put a random number, 200. Select the type, which is meter dose inhaler or dry powder, and the quantity of doses per inhaler. So 100 doses per inhaler. And similarly for those sold in the pharmacy. So this you can get information from the hospital pharmacy, number of inhalers that are sold in the pharmacy, select the type of inhaler. Just a minute. And put in the quantity of doses. I'm just putting random numbers here. And the third one is prescribed by doctors. So under this section, we'd have the inhalers that are prescribed by doctors, but are not used in the hospital or sold in the pharmacy. So this would be the patients who are taking the prescription and buying it elsewhere. So under here as well, put in the number of inhalers prescribed, the type of inhaler, and the quantity of doses. Right, now moving on to the next page. Now I've come to the last section, which is waste management. Under this section, we'll be estimating the emissions that come from the disposal and subsequent management of waste that is generated by the hospital. So the first section here asks for the composition of non-hazardous or general healthcare waste. So if a hospital is measuring the weight of the waste that it produces, then you can enter the values in here. If you don't have it, you can press no. If you have that information, you can press yes and enter that value in here. So here what it's asking is for composition of municipal solid waste in percentage. So if the hospital is measuring it, you can put in it generates 20% of the waste is paper waste, 30% is food waste, 10% is green garden and park waste. You can put a plastics as 20% and other as 20%. In the next section, it's going on to solid waste disposal. So this section covers all of the waste that is sent to landfills or garbage dumps from the hospital. So if you do not have data, for example, if a hospital is not measuring how much of the waste it is sending to each category, then you can put in data not available. And then in subsequent years, you can start measuring how much waste the hospital is sending out. So if it is estimated, you have to also click if the activity is taking place in situ or ex situ. So in situ means happening in the premises, and ex situ means it's being outsourced to another company. For example, either a government waste management facility or a private waste management facility. So here you have to put in the unit and amount of waste that is sent either to landfill or garbage dump. And if you don't know, you press don't know. So if, for example, one hospital sends 1,000 kgs of waste to garbage dumps. And that's the information you need to put in here. Next is composting. So in this section, it'll estimate all the methane and nitrous oxide emissions that come in from managing organic waste in the hospital. And here again, you have to click if it's an in situ or an ex situ activity. A lot of hospitals do have on-site composting services. So if that is the case, then you have to click in situ. And here again, put kilograms and how much of the waste annually is being sent to composting, and gives you the emissions. The final category in waste is incineration. So a lot of biomedical waste and even other waste is sent to incineration facilities. Again, click if it's in situ or ex situ. And here they're asking for the different types of waste, how much is sent to incineration. So for example, if municipal solid waste is not sent to the general waste management or is not recycled, and if it is sent to incineration, then you have to put it in here. Otherwise, it'll generally be only hazardous and biohazardous waste. So I'm putting in random values. Here. All right. And now this is the end of the Climate Impact Checkup Tool data entry. So the last section, they have a comment section for if you have any additional information or any comments to put in about your healthcare facility and all the processes and the operations that is there, you can put it in the comment section. And there are three options here. You can either save your entry as a draft, and you can come back later to fill in more data or change the data and then submit it to get the results, or you can review and submit your form. So here, once you click review and submit, it gives you a summary of all of the data that you've entered. So from the beginning, it says we've selected 2021 as the year, and we're learning how to use the tool. And it gives you all of the information that you've put in, all of the data that you've put in for all of the scopes. So under scope 1, we put in all of this data. And under scope 2, we put in this. And under scope 3, this is all the data that we have filled. And once you reviewed that, you can go back up and click submit. Are you sure you want to submit the form? Yes. So now you can go to view results, graphs, and reports. And when you click that, down here, you have all of the results from your submission. So this here gives you the emissions per category. So here it gives you, these are all the different categories that we have entered, and this is the emissions from that. And here you can see cooling and fire suppression is the major chunk of emissions from the data that I have entered. And here you can see per scope, what is the emissions here. And from the data that I've entered, scope 1 had the most emissions, and scope 2 and scope 3 had comparatively lesser. And this tool also gives you total emissions per patient per year. And it gives you your emissions and average of Asia. So all of the hospitals in Asia that have submitted, it gives you the Asia average, the India average, and the global average. So it gives you emissions per employee, emissions per patient, and emissions per occupied bed in the hospital. And here in the results section, it gives you treatment summary, which gives you all of the emission sources that you have estimated and provided information for, and which are not occurring in the hospital. So purchase team, I clicked as not occurring, and nothing was not available in what I've entered. So if you have entered some as not available, then that would show up over here. And down here, you get the total greenhouse gas emissions from the data that I've entered. So for what I've entered, 973 tons of CO2 emissions, equivalent emissions, is the greenhouse gas emissions. And it gives you here divided by scope. So it has for stationary combustion, how much it was and how much percentage that is, how much it was for fugitive emissions, how much for waste, and under scope 2, how much emissions and how much percentage it was, and under scope 3 as well. And then specific graphs and charts for each section. So under cooling and fire suppression, freezers was the most emissions from this facility, and refrigerator was comparatively lesser. And here it again gives per gas that was used for cooling and fire suppression. Next is anesthetic gases. I had put in only for isoflurane. Similarly for business trips, employee commuting, and others. So this is what the result section of the Climate Impact Checkup tool would look like. So after you fill in all of the data, this is what the results would look like, and you can download a PDF as well. And here, if you see this map, it just shows a map of all the hospitals around the world who are using the Climate Impact Checkup tool and have submitted their data. All right, now I'll just quickly show you an Excel version of the tool, and then we can move on to questions. So this is the online version of the tool that is accessible on the GHS Connect web platform. But there is also an Excel version of the tool that I'll just open up now. Yeah. So this is the exact same tool, but it is on an Excel version, and this can be used offline. So you do not have to be connected to the internet for this, but it's pretty much the exact same thing, and you can use it on an Excel format. So as you can see here, there's scope 1, same thing, stationary combustion. You can put in whether you've estimated or not estimated or not occurring. And then here you put in similarly all the different fuel, amount consumed, and unit, and it'll give you the data. Similarly, mobile combustion, combustion, fugitive gases, all of the same things. And they have separate sections for each thing. And finally, here you have also the result section. And here it gives you pretty much the same format. What are the emissions for the data that you've entered? Yeah. So that is pretty much the end of the training session. So if anybody has any questions now, please feel free to ask. And also I'll put in the email for contact as well if it's not already there. Okay, so there are a few questions in the question and answer section. So I'll just answer that right now. Does the tool allow for benchmarking with other hospitals? So that's from Kieran. So thank you. Right now, this tool, you can, so as I showed you in the results section, it does allow for benchmarking from your hospital and the Asia average, the India average, and the global average. So you do get to benchmark between these scenarios. You can also do, you can play with scenarios, you can make your own different scenarios. So for example, you can put in your actual hospital data right now, and then you can put in different data, like an assumed data of, if for example, if you are currently using more grid electricity and you want to convert to solar, you can put in that and see how much it varies. So you can benchmark with the averages in regions. I'm not sure you can't really specifically benchmark with specific other hospitals. You don't get access to other hospitals' specific data, but you can benchmark with the global average and the India average or the Asia average. Is there a list of all the data required to input into the tool? Yes. So if you want to use the tool in the health and environment leadership platform, we do have a document that we can share with you. I'll just share it right now on screen. So if you can look at this, sorry, this one. So this is a list. This is a document that we can share with you. And it lists all of the data that's required to fill up in checkup tool. So initially you have to fill in institution information like about the hospital and local climatic information, but it's divided here. This document is divided by scope, all of the information that you will need. So stationary combustion, what is all the information, and the source is also where you will get these data from. Scope 1, Scope 2, and Scope 3. So this document lists out all of the information that you will need. There is also a guidance document, which is more detailed, which will tell you how to use the tool. So you will get access to that PDF as well. I'll just move on to the next question. So someone has asked, where does the hospital obtain the data from, for example, biodiesel, and how to know how much you've used in a year? So all of this data you will have to get from the different hospital departments. So for example, if the hospital is using biodiesel in any like vehicles, for example, you'd have to go to the department that is overseeing transportation and get how much biodiesel they're using or how much petrol they're using. And you can look at the bills and go to the account section to see all of the bills for how much they're spending on petrol, things like that. So all of this information you will get from the different departments. For example, use of anesthetic gases, for how much it's sold in the pharmacy. This you will have to go to the pharmacy department to ask them how much they are selling or how much they are using. And similarly for electricity, you go to the engineering department or again the accounts department to check the bills for how much electricity is being consumed. Dr. Shamlas asked a question. In our country, all biomedical waste is not incinerated. HCFs give the different categories of waste in color-coded bags to common treatment facilities, of which the incinerable waste is only 30%. So will you reflect that? So here, you can put in, so if you know exactly how much of your waste is going to incineration and what weight that is, you can put in your tool that it's only 30%. So if you know that this 30% of the waste, which is this much kgs, goes to incineration, then you have to put that into the tool. So if, for example, you're sending all your waste out and you're not sure how much of it is being incinerated or how much of it is just being put into the landfill, you'll have to put an average estimate or go find out what is happening in your for your waste. So best practice would be to have a proper team that first measures all the waste that is generated in the hospital and finds out exactly where all of this waste is going, and then you can put in that data into the tool. Is it all, so somebody has asked, is it always possible to reduce these numbers? For example, inhalers, those are needed. Yes, so a lot of emissions you can reduce. So for example, if a hospital is using coal-fired power, you can change it into solar power and that will reduce your emissions. But there are a lot of emissions that you have to run a hospital. For example, if you can't reduce a number of inhalers, you might have a certain number that has to be used, and that will be your residual emissions. There are some emissions in carbon footprinting that are termed as residual emissions, which will occur and you cannot reduce. But having said that, you can also be more efficient in delivering healthcare and make sure there is no wastage of inhalers, there is no excessive prescription of inhalers where it is not necessary. These steps can help to reduce the number of inhalers that are given. And also there will, as I said, be some residual emissions in a hospital that are always there, but the goal is to try to reduce where you can. Next question that they've asked is, will this recording be available? Yes, we will send this recording to all of those who have registered. So yes, we will share this recording with you. So those are all the questions in the Q&A box. I'll just see if there are any other questions. If anybody has other questions, please feel free to raise your hand or ask. Okay, there's also some questions in the chat box. Let me just get to those. Okay, so Jayashree has asked, how do we make sure that we have covered all the emissions from the hospital under all three scopes? So like I mentioned, this tool asks for emission sources for 3 different scopes, and they ask a lot of data for each scope. And the fact of the matter is a lot of hospitals do not have that data now. So I am working with a lot of hospitals in India right now who are using the tool, and a lot of them don't have all of the data right now. And this tool also has a provision to mention that you do not have the data. So for example, if you don't have data on some specific thing, like if your hospital currently doesn't measure waste, you can just put data not available, so it is not estimated. And then your results report will say that this is the emissions from the hospital, but these are the sources that aren't estimated. The results will give you that as well. And then you can start measuring all the emission sources that you don't have in coming years. So this tool can give you sort of an idea of what are all the things that you can start monitoring in your hospital. If you currently don't have it, you don't have to put in the data. You can click it's not available and you can start measuring it later. Is there any checklist material? Yes, like I showed you, there's a PDF document that we can share with you, which will have a checklist of all of the information that you need. Yeah, that's it for the questions in the chat box as well. Is there another one in the Q&A? So it says, can you show us an example of best practice on the platform? So I'm not really sure what you mean by this. Can you please elaborate on that? I'll allow you to talk as well. Just a minute. Yeah, I've allowed you to talk. So please, can you elaborate on your question?
Yes, when you were introducing the platform, you had, or I had seen something with maybe not best practice. It was called case studies, where people could upload examples. Are you able to show us that?
Yes, so I'll just open up the website again and show it to you. Just a minute. All right, yeah. So this is the GGHH Connect platform, and here we have different case studies from around the world. And we have a lot of, so these are all from member hospitals of the Global Green and Healthy Hospitals Network, and in India, the Health and Environment Leadership Platform. So here we have hospitals doing a lot of different things, and you can select specifically what you're looking for. So we have here improving waste segregation and recycling, recycling in theaters, safe energy sources and energy saving, waste reduction and recycling. And here we have the region as well. So you can select which region you want, which type of sustainability initiative you want, etc. So I'll just open up any random one. So this one says hospital carpooling app. And you have here the PDFs. And here is the format of case studies which you have up here. So this case study is about transportation, and here they're trying to reduce carbon dioxide emissions by 3 tons per year through having an integration of sustainable transport and carpooling apps. So this is a case study of what one hospital has done, which is, sorry, I'm not really sure where this is from, but yeah. So this is an example of a case study in a hospital, and you will have many such case studies available for different sections on this platform. So again, you'll have to be a member of the network to get access to all of these, but there's a wealth of information available under case studies here for a lot of different things for what hospitals are doing around the world. And also, there's webinar recordings as well. So just like this webinar, there's webinars from all over around the world, not just from our organization. There's webinars from all around the world that will be available here, specific to each category. So if you want webinars on energy management, if you want on chemicals, pharmaceuticals, waste management, all of these, you can select and watch these webinars as well. So does that answer your question?
Yes, thank you so much.
You're welcome. All right. Does anybody else have any questions?
So, Indu, hi, this is Purnima. Just can you kind of tell the participants the association with the Healthcare Climate Challenge? Because I'm not sure that everybody who's here today was there in your webinar. Maybe it'll help to set some more context as well.
Yeah, so there's also this challenge right now known as the Healthcare Climate Challenge. Wait, let me just open up just a minute. Yeah. So we have this thing known as the Healthcare Climate Challenge. So this is a challenge that has been developed by the Healthcare Without Harm organization. And this is an initiative that is mobilizing the health sector to take climate action. So hospitals around the world, you can sign up for the Healthcare Climate Challenge, and all hospitals who sign up are required to take action for climate change in these 3 different pillars. So one is mitigation. So hospitals who sign up are pledging to reduce their carbon footprint. And this they do by, for example, using the Climate Impact Checkup tool. So we have a lot of hospitals in India as well who have joined the challenge. And those hospitals are using the Climate Impact Checkup tool to measure their footprint and also taking steps to reduce their footprint. Another pillar of the Healthcare Climate Challenge is resilience. And under this, we have hospitals taking steps to prepare for the impacts of climate change. So as you might know, because of climate change, there's going to be a lot of extreme weather events and also a change in disease burden and shifting in disease burden. All of this is going to affect both public health and also the health facilities themselves. So we have hospitals who are doing things like risk assessments and vulnerability assessments to identify how climate change is going to impact their facility, and then taking steps to prepare for that. And the third pillar for the Healthcare Climate Challenge is leadership. So under this, we have all the hospitals who are participating in the challenge. They are taking steps to educate their staff, educate the patients, educate the surrounding public on climate change and its impacts on human health. So this is a challenge. Currently, there are about 7 hospitals in India who are participating in this challenge and about hundreds around the world who have joined. And all hospitals who join will get membership in the Global Green and Healthy Hospitals Network. And if it's a hospital in India, you will get membership in the Health Network. We'll also have access to GGHS Connect, which I just showed you now, which will have, again, all of the tools to measure your footprint, guidance documents. It'll have case studies and the discussion forum. And you will also get training and guidance on how to implement all of this mitigation, resilience, and leadership. So you will get tips on how to implement all your things in the Healthcare Climate Challenge. And there is also an awards, Healthcare Climate Challenge Awards, where participants who are participating in the challenge, if they submit all of their data through GGHS Connect, they are eligible to get global recognition and get awards for their participation in the challenge. So yes, if anybody is also interested in joining the Healthcare Climate Challenge to take climate action, please email us in this email ID. It's help.ch@phfi.org. I will put this in the chat box as well. So we have hospitals from 43 countries who are participating in this challenge. And we would welcome any hospital here who is listening. If they want to join the Healthcare Climate Challenge, please do. Again, I'll put in the email in the chat box. So this is an email for the Indian arm of GGHS. So anyone, hospitals in India who want to join, please email here. Yeah. Any other questions? Kiran, can you please tell me where you're from? Are you based in India, Germany? Okay. So we Healthcare Without Harm also has a Europe section. So we are primarily focused in India and working with hospitals in India. So Healthcare Without Harm, which runs again the challenge and also develop the tool, they have a Europe section as well. So it'll be more helpful if you contact Healthcare Without Harm Europe, and I'll try to find their email and give it to you. But if you want to access the tool from Germany, it'll be better for you to contact them. So they work in countries in Europe. So I'll try to find. Okay, all right. So just get in touch with them and they will help you to access the tool from Germany. Yeah. Any other questions? If not, we're at 6 p.m. now. Feel free to email us at that email address as well. Even if you're from around the world, you can still email with any questions to that ID, and we can answer your questions or direct you to anybody else who can help you. All right. I think there's no other questions now. So thank you so much, everyone, for joining the webinar. Hope it was very useful for you. And we will send you the recording for the webinar shortly. So please look forward to that. And again, send us any questions. If you want to join the Help Network, please email us. And if you also want to do the Healthcare Climate Challenge, also please email us and we can help you out with that. All right. Thank you, everyone, and have a good night.